Hello, so today I would like to focus on cystic fibrosis as part of our West 7 Respiratory Series. So, as you know, we specialize in several different respiratory diseases on West 7, one of which being cystic fibrosis. So at this point, I would just like to take a few minutes and give you guys a brief overview of what care for cystic fibrosis patients will look like. So, what exactly is CF? So, cystic fibrosis is an inherited disease that affects the lungs and the digestive system. So, the body produces thick and sticky mucus that can clog the lungs and obstruct the pancreas. Cystic fibrosis is the most common deadly inherited disease. Worldwide, about 70,000 people have CF. Each year of those 70,000, only about 150 to 200 CF patients receive a double lung transplant each year. So of those patients that do receive a lung transplant, about 50% of them will live for another 5 years or so. So let's dive into some treatment options for the CF population. So first, we have airway clearance. Airway clearance is necessary for CF patients to perform both at home and in the hospital. So airway clearance or chest PT can be done a couple of different ways. This can be done manually by means of cupping. During cupping, the respiratory therapist will focus on an area of the lung that is the most junky, just to kind of help give a focused clearance to that one part of the lung. Additionally, some patients use what's called vesting, which basically is just a vest that vibrates that helps to break up the mucus, which makes it easier for them to cough it out. So while they're in the hospital, our respiratory therapist for the unit will be the one that does all airway clearance therapy with them. So second, nutrition. It's a very important aspect of care for the CF population. So CFers often receive double portions at meals as well as extra snacks from dietary as well. So in our unit, dietary puts the extra snacks in the patient-specific fridge in the kitchen. And additionally, the CF Foundation provided us with 4 mini fridges that on admission should be put into each patient's room. Please note that per our policy, the temperature of the fridges should be checked at least once every 24 hours for their entire stay. And there are different forms behind the secretary's desk that should be with the fridge just so we can verify that the temperature has been checked. Additionally, many CFers actually have PEG tubes or Mickey buttons to help supplement their nutrition in addition to eating. Oftentimes, the CFers will have overnight tube feeds that run. So it's also important to note that CFers also take pancreatic enzymes of some sort, so either Crean, Zempap, there are several different kinds, with meals and snacks to help digestion. It's also important to note that patients with CF do have fatty stools. This is normal for this population, so just don't be alarmed if you see this. So third, CFers use nebulizers and inhalers to help thin the mucus. They do this both at home and in the hospital. So as with the airway clearance or chest PT, this is the responsibility of respiratory therapy on our floor. So it's just important that as nurses, we communicate with the respiratory therapist to help with timing. Oftentimes, our patients will want pain medicine before chest PT. So just communicating with respiratory therapy is very important. So additionally, CFers also take antibiotics and often steroids at home. During their exacerbations or tune-ups while they're in the hospital, most patients are on usually 3 to 4 IV antibiotics during their stay. As a result, all CFers during their hospital stays will have some sort of central access. Some of our CFers have iPads that will be accessed on admission and re-accessed every 7 days per our policy. And many of our CFers also get PICC lines at the beginning of each of their admissions. Um, and again, those dressings are actually also changed every 7 days. So now that we covered some of the treatment options, I would just like to go over a misconception. So there is no cure, unfortunately, for CF at this point. Um, some people believe that the double lung transplant will cure CF. Unfortunately, it does not. Patients with CF still do have cystic fibrosis even after the lung transplant. So next I would like to just go over some resources that we have on the floor. So Monday through Friday from 8 to 4:30, there's a complex care center NP in-house that helps with different concerns nurses might have and just helps with different order sets. Um, Additionally, the attending from the complex care center will see the patient every day, Saturday and Sunday included. Um, and this is just very beneficial because they know the patients from outside of the hospital. They're very familiar with their care, and it just kind of helps to have someone that's very knowledgeable with the patient population. Additionally, both the NP and the attendings for the complex care center round daily with the nurses who have these patients, and they have a very good open line of communication with the nurses. So you always are in the loop and never hesitate to reach out to one of them if you have any questions. Um, so additionally, the complex care center also gave us an exercise bike that patients can use, as well as Wii Fits. So this just helps to make sure that while in the hospital, patients are able to stay active and not deteriorate. So additionally, as always, we should be using policy stat if you ever have any questions. Um, in addition to that, there are several people on the floor that are so there are several unit champions on the floor for the complex care center for CF patients. So feel free to reach out to any of us if you ever have any questions. Additionally, charge nurses are always a great go-to resource if you have any questions as well. So it's also just important to recognize that patients with CF also suffer from chronic pain. Um, as a result, it's our duty as nurses to help manage that pain and symptoms the best that we can for these patients and just really to try to help improve quality of life. So I hope that this overview helped you guys. Let me know if you have any questions. Thanks.